Then you'd also put the mom on the application. And so the mom and dad are the adults on the application, but you'd put them as not applying.
Correct.
And then you'd have the two kids as the dependents. And then there's a spot when at the beginning of the application that says, who all's applying. You would just check the kids. And so you'd have one application that has all four of them on it, but only the kids are applying for coverage.
That's correct. But
And
however, when I, sorry,
mhm.
go ahead.
No, sorry, go ahead.
Yeah, when I enroll them as a Blue Cross Blue Shield,
Hmm.
so they mail them healthcare insurance plan. They put one of children as a primary and the second children as a dependent. I
Yeah,
don't know why.
that's common.
Oh,
Um,
okay.
yeah, so for whatever reason, Blue Cross, um, it's a family plan, so there can only
Hmm.
be one primary. Everyone else
Okay.
is considered a dependent.
Okay. Got it.
So
So that,
so it,
yeah.
it's the same coverage, but you'll notice that on the cards where it'll say dependent and then have one of the kids as a primary.
Okay. Great.
So that
So,
nothing to be concerned there.
hmm okay. So that's my first question. So Julie and Maggie, do you have any question regarding this before I move to the second?
No, no problem.
Okay. My
Well, good
second
job.
question is,
Congrats on getting new clients.
Yeah,
Um,
she's a good.
I wanted to ask just before we move on to the next person, just to help take you to the next level, right? So signing them up for health insurance is good,
uh-huh.
but I want to get you guys to a point where you're advanced sales professionals. So
Mm-hmm.
did you mention what plan did you pick for them? It was a Blue Cross plan, you said?
My blue gold.
My Blue Gold. Okay. How much are they
Mhm.
paying for it?
They pay for full because
They
their
don't
income
qualify.
is, yeah, they don't qualify.
What's the reason for not qualifying? Is it income?
Income.
They make a good income, like
Uh-huh.
over 200,000.
Correct.
Okay. So they pull full price. So what is that, about 800 a month maybe?
No, I think probably less than 600.
Less than 600. Okay. So less
Uh-huh.
than 600. Do you know off the top of your head how much their deductible was?
I think their deductible is high. I couldn't remember. Let me double check. Probably so I think several thousand.
Okay, call it like 1,500 maybe.
Mm-hmm.
Okay. Do you know what the out-of-pocket maximum is?
I think 7,500.
Okay, so you went with the standard plan. Well, out-of-pocket 7,500. Okay. And
Mm-hmm.
why did you pick the gold plan?
Oh, I couldn't remember because that was the existing client. I enrolled them a month ago. So I think because they want better coverage and also
It's not a trick question. I'm asking
yeah.
these questions for a reason. I'll get okay. So um one, I would just in general avoid selling the My Blue Health plan. That should be your last resort plan.
Okay.
Uh, a few reasons. Main reason is it's going to pay the lowest commission out of all the policies. So Blue Cross is going to pay the least commission out of any ACA plan.
Okay.
The My Blue Health pays the lowest. The Blue Advantage pays better, and the
Mm-hmm.
Blue Advantage is going to have the better network.
I agree.
If
Actually, I enrolled them Blue Advantage browse. I'm sorry. I just
Blue,
saw
okay,
now.
so you did check. Good. Okay, so at least you put them on the one that pays a little bit more. The Blue
Mm-hmm.
Advantage bronze. So you did put them on a bronze.
Correct. So they
Uh,
paid 529 premium.
okay, five.
Deductible is 7,500. Out of
Okay.
pocket maximum is 9,200.
I have that exact same plan on myself.
Okay.
$50 primary doctor, $100 specialist.
I think so.
Okay, good. Yeah, so that's a general rule when looking at plans. And if they don't have any doctors, those Blue Advantage plans are good. Those are a safe bet, but if they have no doctors, look at maybe Ambetter or United Healthcare or Aetna or any of the other companies. Why? Because it'll help your pocketbook, right? And usually the other plans can have a little lower premium. But of course, we
Correct.
want to do what's best for the client. Sometimes Blue Cross is the only option because of the doctors, right? But I
Mm-hmm.
was asking these questions because you want to go back and you want to recommend supplemental coverage to them.
Uh-huh.
And there's two companies you can do that with. One is Allstate, two is Healthy America.
Yeah, I remember you mentioned it last time, and also we we all appoint with a House American.
Healthy America. Okay, yeah, and
Uh-huh.
Allstate great as well. And um
Yeah, we already have all states. Last training you mentioned the House American, so that's why we go to appoint that one. I think I told Maggie too.
yeah, to get appointed with
Mhm.
Allstate.
Yes,
Now,
yes,
the reason why is that as you can tell, your client has a lot of out-of-pocket exposure.
yes.
So I want you to start presenting plans a little differently before you build a bad habit.
Mm-hmm.
Effectively cross-sell, you want at the start of the conversation when you're doing the fact finding, the needs analysis, and you're getting the client's information,
Mm-hmm.
you want to let them know that you want to first ask what their budget is, right?
Mm-hmm.
Get a rough idea. Hopefully it's a realistic budget, right?
Mm-hmm.
And then two, you ask them, would you know having coverage put in place that will help lower your out-of-pocket exposure or eliminate your deductible in the case of something catastrophic, like
Mm-hmm.
accidents, hospital stays, cancer, heart attack, stroke. If I can um, put a package together that will give you additional coverage that'll eliminate those high costs but keep it within your budget, would you be interested in something like that, right?
Mm-hmm.
The reason why a lot of these plans have great preventative care,
Mm-hmm.
right? Great doctor visit coverage, great medication coverage, but for your kids, if both of them in a car wreck, you're out of pocket $1,800.
Mm-hmm.
I know you're well off, but I don't know about you, but the last thing I would want to pay, no matter how much money I have, is $18,000 just down the drain, right?
Mm-hmm.
Um, for very inexpensive, we can provide supplemental coverage that will
Mm-hmm.
provide protection for your family in the
Mm-hmm.
case of those major high ticket, expenses. So you
Mm-hmm.
don't have to write the check. The insurance company will write the check.
Okay, for this case, which kind of supplement plan you will recommend?
So it depends on the company if you're doing Healthy America or Allstate. But with Healthy
Mm-hmm.
America, I don't have it in front of me. I forget what they called it. It's called like the Gap Plus or Gap Edge,
Uh-huh.
for Healthy America. That includes accident coverage and critical illness coverage.
Okay.
Accident coverage protects them if they get in an accident or an injury.
Mm-hmm.
It will write them a check to cover, based on the amount you apply for. So if you do a $10,000 accident plan, they'll get a coverage up to $10,000 if they get in an accident,
Mm-hmm.
which is enough to cover the 9,200.
Okay.
How much the premium?
I don't have it. It's very, very affordable. I mean, you can get with Healthy America like $50,
Mm,
$40,
month. Yeah, I
a
think
month.
I
It's
think
it's
that
it's
is
very, very
price.
affordable.
Oh,
Mm-hmm. Yeah.
Super affordable for the supplemental coverage, right? And
Mm-hmm.
you're doing right putting them on a bronze plan versus a gold. So
Mm-hmm.
what a lot of agents do is they'll put them on a gold plan, and let's say the gold plan is $800,
Mm-hmm.
but the bronze plan is $520, right?
Mm-hmm.
mm,
What's the difference in that premium?
300.
$300. So we're going to use
Mm,
some of that difference in the savings to buy supplemental coverage.
good idea. Mm-hmm.
So they're going to be paying less than a gold plan, and
Mm-hmm.
getting better coverage
Mm.
in the
Okay.
case of something. Because on a gold plan, the max out of pocket is still 9,200.
Mm.
Uh-huh.
So
Yeah, but
you're paying $300 more a month. You get a lower deductible, but at the end of the day, if something major happens, you're still out of pocket 9,200.
that's
So is
right.
paying the additional 300 a month really saving you money? No. I'd
Mm-hmm.
rather use some of that difference to buy supplemental coverage. So if they do get in a car wreck, they're going to
Mm-hmm.
be out of pocket zero.
Okay.
What about the supplemental coverage? I would say also include the parents, four of them, not
Yeah,
just one person.
I would do the kids or I'd do the whole family, right? But
Yeah.
definitely the kids who are covered. And the critical illness, that's coverage for cancer, heart attack, stroke.
But
So if
let me
they do,
ask you a
Correct.
question.
yeah, go
If
ahead.
if the parents does not have a health insurance coverage, they still can buy the supplemental.
Yes.
So supplemental, regardless you have a health insurance or not.
It's a
Yeah.
standalone.
It's a
Is that
standalone,
correct? Yeah.
exactly. You don't want to sell it as health insurance, but it is additional protection. So let's say you don't have any health insurance, you get in a car wreck and you have a $10,000 accident plan. Well, you're gonna get a check for $10,000.
But those are wait a minute. You have a car insurance, right? For car insurance, you also have a personal injury.
Yeah, kind of, right? Uh, yeah, it depends on how your auto policy's set up, right?
Mhm.
Most people may have that coverage, but it may be limited. It may be not enough to cover your deductible or out of pocket. But there's three types of supplemental plans. Okay,
Mm-hmm.
there's accident,
Mm-hmm.
there's critical illness,
Mm-hmm.
and then there's hospital indemnity.
Mm-hmm.
Yeah, and also accident plan is not just cover car accidents. For example, you go to hiking,
Yeah,
you break your ankles,
Mm.
it will be covered too,
Or
right?
exactly. Yeah,
Yes,
bicycle, like
bicycle
yes.
wreck, or
okay.
you're putting on the Christmas lights during Christmas and you fall off the
Yeah.
ladder, right? Um, a client of mine went camping with their kids and the kid cut their leg, right?
Mm-hmm.
Things like that. So it's accident injuries.
So accident injury basically covers the medical expense, right?
Yeah. Yeah.
How
Medical
about
expense.
what's the difference between Allstate and Health America? I
Not
mean, Health.
much. Not much.
Okay.
Slightly different product design.
Mm-hmm.
Um,
Cost wise, for example.
yeah, Healthy America is going to be less expensive than Allstate,
Mm-hmm.
but not always, generally.
Mm-hmm. Mm-hmm.
Generally, Healthy America is going to be a little less expensive.
Mm-hmm.
Allstate is going to be an easier sale because it's a bigger brand company,
Mm-hmm.
right?
So
Um,
can you show
and,
us
and
how to get the quote through Health Zappa?
yes,
Yeah.
I will show you how to get those quotes. Let me make a note because I want to get to her other two questions, and then
Yes, we
I'll
Yes,
will
it's
do
circle
that
okay.
back
later.
I'll circle
Yeah,
back at the end, and I'll show you how
Yes.
to run an Allstate quote.
Okay.
okay. Yeah,
Let me get my glass. Okay, you go ahead and continue.
Sorry
yeah,
to
I will
go off
continue.
topic, but I think this is important because I want you to start developing this
Mm-hmm.
skill now while you're new.
Mm-hmm.
Otherwise, you're going to build a bad habit of forgetting, and
Supplement.
it's
Yeah.
a lot harder to sell a supplemental plan after you present a plan and then go back, "Oh, by the way, would you like to add a $80 a month plan?"
Mm-hmm.
They're going to say no. Versus if you
Exactly.
do it during the beginning and build it in as part of the package, you build the
Mm-hmm.
value,
Mm-hmm.
it's a lot easier of a sale.
I agree. Especially for this case, because their parents, they feel like, oh, they cannot get any saving. That's why they don't want to enroll the healthcare insurance plan, just the children. So I always feel like they are under risk. So the
Well,
supplements plan will
they
give
can
them
do a
some.
private plan. They can do a short-term medical plan, the parents
I quote for them because they are
for pivot.
old. Yeah, it's expensive too. It's like more than 700. I think it's similar with Obamacare. They feel like it's too expensive, you know.
Yeah. Yeah.
So,
Well,
so talk about the private plan. Are you talking about United Healthcare? What's the company called?
Golden Rule, United Health One, Golden Rule.
Can we sell those as well?
Yeah. Well,
Wait a second.
I have to make
Uh,
sure you're contracted, but yeah, it's a United Health One contract.
yeah, United Health
Um,
One. We can get a contract too because some people have a captive agent. They sell our client those private plans.
Yeah, no, that's a different product. It's called. I think I know what you're talking about. They're U.S. Health Advisor. They use United Healthcare's network.
correct.
Yes,
It's not a United Healthcare plan.
yes.
Um, yes,
They
it's
are
cost
in indemnity.
free.
They are indemnity plan. Basically, they are.
That's it. Yeah, they're crap plans. You come across
Yes,
anybody on that, they're awful plans. You need to explain it to your client.
but
They're not.
some people buy it. I have a
They
client. As
buy
a
it because
matter of fact,
the agents make it sound very appealing.
yes,
Oh, you don't need that Obamacare stuff. That why would you do an Obamacare plan? I can give you a nationwide PPO plan. You can see any doctor. It's with United Healthcare. You've heard of United Healthcare, right? Oh yeah, they're the biggest insurance company. Yeah, so what would I
No,
would it
yeah,
be okay if I give you
it's
a
not as
quote?
good as Obamacare. Hmm.
No, nowhere is good because it's an
Hmm.
indemnity. It works kind of like that accident plan. If you go to the hospital, it's only going to pay up to a certain amount, and
yes.
then the client's on the hook afterwards.
Okay.
As a matter of fact, one of my agent is under that plan. Do you remember the gentleman who participated in your training last time who was
Hmm.
not there? He's
Yeah.
in China now. He said that somebody sold him but he has a specific medicine, he said. And he said, we will talk about that later. Maybe that medicine, it has to be. I don't understand those.
Yeah, they're very secretive on explaining it, but that agent would be better off on an Obamacare plan
Okay.
or one of the short-term medical plans we can offer.
Yeah, that would be
Mm.
great because I was trying to see where I can help them to purchase Golden One, and I was told so they stopped the Golden One this year.
No, the Golden Rule is still available.
Oh,
Golden Rule
Golden Rule.
through United Health One. Those
Okay.
private plans, but when say private plans, I'm talking about short-term medical plans.
Yes, yes.
They're limited to
Short-term
month.
medical. Well, what about that? Can we spend a little bit of time? Me and Judy is not familiar. Like the private plan, short-term medical plan, what does that mean?
All that means is it's non-marketplace. It doesn't follow the Affordable Care Act. So it doesn't have to meet minimum essential care.
Mm-hmm.
So they won't cover pre-existing conditions, and they're not required to cover medications, right? But it is major medical. So the way it'll work is you'll have a deductible, you'll
Mm-hmm.
have a max out of pocket,
Mm-hmm.
and then you'll have a coverage limit amount. So say $1 million
Mm-hmm.
of coverage
Mm-hmm.
or $2 million of coverage.
Mm-hmm.
And so as long as it's a covered service, which is typically everything but pre-existing conditions,
Mm-hmm.
usually they don't cover maternity or mental health, but they'll cover,
Mm-hmm.
doctor visits and hospital stays and
Mm-hmm.
surgeries,
Mm-hmm.
subject to your deductible, right?
Mm-hmm.
So let's say the deductible is $5,000, and you
Mm-hmm.
might have a, you know, 20% cost share after your deductible
Mm-hmm.
and a 10,000 out of pocket limit
Mm.
and $1
And
million
they will
So
be
health
cheaper.
one
and
is
they're typically PPO plans, so you have a bit better
PP.
network, more
Okay,
access.
got it.
Correct. And it's
And
cheaper
health one, we
comparing.
can get appointed health one.
United Health One is what it's called. So three companies offer this coverage. United Health
Uh-huh.
One. United
Mm-hmm.
Health One is United Healthcare. It's actual
Okay.
United Healthcare.
Okay.
Um, and then you have Allstate,
What's the date? Okay.
and then you have Pivot Health, Pivot.
CIVOT. Are we,
Yeah.
if we get appointment with Allstate, it will already cover that.
Yes.
We can
Allstate
sell them.
includes all their products.
Okay, we want you show us like later how do we quote those?
Sure.
Okay, a pivot. Are we get contracted under Shore LC pivot?
Yes,
I
under
don't
sure
see
see.
that. Oh,
If you don't
really?
see it, let me know. I know some
Okay.
agents have been having problems seeing it in their Sure LC. So
Mm,
if you don't see it, shoot me an email and I'll get with Shannon to see what the deal is. I think we're
okay.
having a problem with Sure LC
Oh, okay.
for
Oh,
pivot.
that's good. Thank you. So we
But
you can
yes,
move on.
so
Mhm.
now we'll I'll made a note, we'll cover that. So Julie, just
Okay.
Mary, so we don't go off of topic too much. What's your second question?
Yeah.
Yeah, my second question is about dental. So I enrolled one client for the dental Blue Cross Blue Shield dental
Okay, I'm gonna
with
stop you right
ACH.
there real
Okay.
quick. First mistake is never sell Marketplace Dental.
Okay.
Oh,
Don't ever
really?
sell it. Don't sell it.
Why? Why?
One, you probably won't get paid.
Oh,
That's the
Oh,
big
really?
reason. Okay.
Okay.
So lesson learned, don't ever sell Marketplace Dental.
mm-hmm,
Um, one, I don't know those plans very well.
mm-hmm,
Well, so we always recommend you just sell an individual dental plan straight
mm-hmm,
from
Okay.
the carrier. So if you have, say, an Allstate contract, you can sell an Allstate dental plan, or
Hmm.
United Healthcare, you can sell a United Healthcare dental plan, right? You
Hmm.
write it directly through the carrier. That way we
Okay.
get paid.
Okay.
Oh,
I got
direct
it.
through the carrier?
So
Health Sherpa? Use Health Sherpa?
no, don't use Health Sherpa for dental. Health Sherpa, those dental plans are marketplace dental plans, and a lot of those you may not get paid on,
Hmm.
and it's not great coverage.
So we use the individual portal. Can you give us a few good dental plan
Yeah, I'll
carriers?
forward you a training I did
Uh-huh.
that you can send out to the team. But there's a
Mm-hmm.
few good ones I like. One is United National Life, United Healthcare,
Hmm.
Cigna,
Hmm.
Allstate. Um, let me think. What's
How
another good?
about
What is
Delta?
the first one?
Oh,
United what?
United National.
Oh, United Nations.
Mary, what did you say?
How about Delta Dental? Because a lot of provider in their network,
Who?
dentist. Delta. DL. Delta. DL.
Delta. Oh, Delta.
Oh,
We don't
Delta.
have Delta's contract.
Okay.
Um, but let me think. United Healthcare, Cigna, Allstate, Mutual of Omaha's not bad.
Hmm.
Um, but I mean,
What
one of those
Mutual
are gonna,
Omaha? We have not got a contract.
yeah. So there's quite a few good dental. There's Emeritus as well.
Okay.
Emeritus?
Emeritus, yeah, they have a pretty good dental
Yeah,
Emeritus.
plan.
Emeritus. Yes, we
Okay.
already applied.
So any
Maggie,
of
you
those
already applied
companies will be
Emeritus.
fine, but just use ones you're contracted with already.
Uh-huh.
Humana's got dental, right? You're all contracted with Humana. So, um, I usually just stick with United, Cigna, Allstate. Those are all great companies and
I
pay
don't
good
know.
commission.
Allstate has dental too. Okay.
Yeah.
That's good to know.
Um, yeah, so they have a really good dental plan. It may not be the least expensive, but it's a good plan.
Mhm.
And I'll show you when I run the Allstate. But sorry, I didn't mean to cut you off, but what was your question regarding that?
Uh, yeah, because I enroll them through the marketplace. I don't know if I get paid. I think I do because when I get sick, there are some dental. However, when they log into the Blue Cross Blue Shield mobile application,
Hmm.
they couldn't see their dental coverage and the claims.
Yeah, that's a good question, and I'm not going to be much help because I've
Hmm.
sold zero marketplace dental plans.
Okay.
I don't
Yeah,
think
I
I've ever
probably will
sold a
call
single
them.
one. So I don't know exactly how it works.
Uh-huh.
If it's through like a separate company or if there's a separate portal they log into. My
Uh-huh.
best advice would look the number up on Health Sherpa. I think when you look at that plan, there's a number they can call.
Yeah, I will call them tomorrow.
to find out so why they
Mhm.
can't see the claims or what the portal is. Uh,
Mm-hmm.
sometimes maybe they haven't paid for it. I don't know, right? There could be a lot of reasons.
Okay. So the third question, I think you will need to demo too, so then we can do all the demo together. So I remember several weeks ago when you do the training, you're saying, okay, so we can leverage market material to do some Google website. I was trying to do that last night because I know you said it was homework and I couldn't find it any longer. I'm sorry.
The marketing materials,
Uh-huh.
I'll show you where to find the marketing materials.
Yes, yes.
On,
Thank
on the
you.
website.
Yeah, on the website.
Yeah, well, did y'all set up a Google business page?
Not yet.
No. Tis. You
Don't know
leave
how to
money
do
on the
it.
table.
I'm
What?
sorry.
That's okay, Maggie. What did you say?
I don't know how to do it.
Well, there's training. I'm gonna show. Okay, so let me share my screen
Hmm.
really quick. What's this? Google Chrome. Share. Yeah. Let me go. Okay, first, let me show you just where to find the marketing material. That stuff's easy. Cool. So you go to
It's
tools
under
at the top.
tools. Ah, yes.
Okay. Well, there's two places. So one, you hover under tools, there's customized marketing material.
Okay.
Okay. That's you can find different stuff, Medicare, ACA, life insurance, very professionally done. It downloads with your information on it, right?
Mhm.
The other place is under the Agent Tools homepage.
Okay.
Um, left-hand side under social media and marketing resources.
Uh-huh.
There's some over here. This is Maggie, where you'll find how to do the Google business page, right?
Mm.
So right here, Google My Business. It's a step-by-step guide on how to do that.
Oh,
Okay.
oh, Google my business.
Step-by-step guide on how to set up a Facebook business page. These
Oh,
Okay, great.
these courses, if you had to hire a social media company, would charge y'all thousands of dollars.
hold on, hold
We do
on,
it. We give it
Sava.
to you for free.
Hold on, Sava. Let us experience. I'm looking at my portal. Tools agent. Go to the tools agent portal homepage.
Agent Tools homepage,
And
left-hand
then
side,
social media. Let's see, left hand. Social media university.
social media and marketing resources. At the
I
top,
don't.
Agent Tools home. You got to log into your agent portal.
I am
The
So
last
Agent
one, you
mm,
Tools,
scroll down,
you got to
Maggie.
scroll down. It's the
tool, but
very
the
last.
tools then agent tool home, right?
Yes,
Mm-hmm. Yeah, I saw
Then
it. Mm-hmm.
it's right here, the very last box.
very last. Oh, social media marketing resource. Okay, got it.
That's where you'll
Uh,
find all the training. You'll find the social media packages, the social media ad packages, um, and the training on how to do anything social media.
oh, even sign up for Canva.
Right. So tools to help you manage your social media as well, like Canva and Buffer.
Hold on, Google. I'm getting to know where is the
Google
understand
My
the
Business.
Google. Oh, Google My Business Watch. Okay, got it. Oh, this is
Yeah,
useful. Got it. We should
very,
all do.
very useful.
Hmm.
That'll help you all. And then if you need additional help, I
Mm-hmm.
don't mind helping, but I'm not the expert. You can
Hmm.
schedule a call with the social media expert
Okay.
who has a degree in this stuff right here. You just schedule a call with her.
Hmm.
Um, and then there's some more marketing material for Medicare in the middle column under senior/Medicare.
Hmm.
There's some stuff you can find here like for seminars, uh, flyers, Medicare 101 flyers, the Fact Finder, Medicare supplement postcard. And then for Obamacare, if you hover over tools, there's a
Mm-hmm.
spot here that says individual health dashboard.
Hmm.
Okay. Mm.
And then this is where you'll find, I know I did a training on this already, but things like ACA versus short-term medical.
Oh,
It's a circle, explains the difference between ACA and short-term medical and the best people that would fit. There's things like special enrollment periods.
Yeah, I think Fact Finder
Yeah,
is
there's a
useful. Thank you,
fact
Savva.
finder.
Yeah.
Yeah, fact
Mhm.
finders in there. Calculators for the family glitch.
Mhm. Yes.
Carrier portals to log into your carrier portals.
mm-hmm,
Um, the federal poverty chart is in here.
mm-hmm. Oh,
Um, carrier materials. That's a little outdated there, but it's still kind of helpful. Frequently asked questions, agent support lines. So if you need to contact the broker support lines for every ACA carrier, there it is.
you mean Empower's support line?
No, 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 the carrier support line. So if
Oh,
Mary needs to call Blue
Oh,
Cross, she can get the broker support number by clicking
okay,
it. It's an Excel download.
got it.
Um, so a lot of helpful ACA materials in here.
mhm.
And then you do the marketing on the marketing materials right here, customized marketing materials. And you go to health insurance. So I would encourage y'all to spend a little time going through the website. There's a lot of nice resources. There's a health insurance brochure, Affordable Care Act, Obamacare, policy reviews. So nice flyers that you can download and print off and take it to places. Let me show y'all Allstate next. So Allstate, the website's a little different. It's N for Nancy, G as in, let me see if I can
Can you copy it on the
yeah,
chat
that's what
box?
that's what I'm about to do.
Mm-hmm.
Let me see.
But we never have one yet. Should we do the first time just reset password?
Well, when you get contracted, they should send you an email. What
Oh,
a chat
I
feature.
Think
already
so.
contracted, but maybe I just ignored that email. Mm,
It can
That's-
you can use forgot username and password, Maggie,
yeah, you
to
can do
reset it.
forgot username or password, or you can
okay,
always call one to help you get in. Uh,
okay.
But oh shoot, I mean, give me a second. I gotta look at my password
Mm-hmm.
on here.
So Maggie, remember the clients I asked you the other day when we were
Mm-hmm.
in Lisa's place? So I
Mm-hmm.
helped that client to purchase accidents plans through Allstate.
Oh, okay.
Uh-huh.
How much did you put on?
I think they just need to pay probably around $40 per month.
And then get a coverage 200K?
I need to double check. I forgot it. It's around
Mm.
that, like that. Uh-huh.
Mm.
Yeah.
Okay, there we go. Okay, so this is the back office where you can, and Garrett is our Allstate specialist, Maggie.
Mm.
So if you guys ever need help, I'd highly recommend you reach out to Garrett. But you
Okay.
just hit quote and enroll. Let's just put in, say, April effective date. Give me a zip code.
76244.
Okay. And then just give me a random date of birth.
December 20th, 1990.
Okay, female. We'll hit quote. So fixed indemnity, whoops. Fixed indemnity, I would recommend Plan B or Plan C.
Mm-hmm.
Now, what this is a hospital indemnity plan that will help cover um, their hospital copay. So they get a benefit for hospital admission and a per day benefit if they're in the hospital, plus
Mm-hmm.
ambulance coverage.
Okay.
Plan B or Plan C, right? So pretty
Okay.
affordable. $30,
Mm-hmm.
$36.
So no
Um,
Mm-hmm.
age because the birthday. How old is this person?
that person's 34,
Okay.
right? But that's what the fixed indemnity is down here, hospital expense plan. You just add it to the cart. Now that particular plan has a one-time application fee that they'll have to pay. But it's a good plan. Then you have dental vision. They have quite a few dental vision plans. Uh, the copay plans are really nice where you just have a flat copay depending on what you get done.
Mm-hmm.
The copay plan too, you would have to package it with something else to be able to sell it, and there's no waiting periods. The regular copay plan has a 6 month waiting period,
Okay.
but the dental plans are pretty good. They're all PPO dental plans.
Uh-huh.
Uh, these are the regular plans. So the value plan is just for people who want like cleanings. The plus plan includes some major services. And then their most robust plan is the prime plan. It
Uh-huh.
includes the most coverage, the most benefit allowance, has some
Okay.
orthodontic coverage in it. And then here's the copay plans.
Okay. So, Sarah, one quick question here.
Mhm.
So, does Allstate has the website for members? They can track the dentist?
Yes. So Allstate has a consumer website. I think it's like allstatehealthsolutions.com
Okay.
or something, where you can log in and you can check your claims and everything, or you can
Mm-hmm.
check dentists. If you download the brochure, there's a link right here
Mm-hmm.
where you can search dentists.
Okay.
Um, so that's how you quote the dental. Short-term medical right here. With short-term medical, if they answer a few questions, they may qualify for preferred rating. So if you had coverage in the last 9 months, and here's the preferred questions. Do you own a motorcycle? Do you have any driving violations, speeding tickets, or DUIs in the last 2 years? No. And then do you take any medications for blood pressure, cholesterol, anxiety, or depression? No. Now they get preferred rates. You can do 4 months at a time under current law. The enhanced plans are going to be your most robust plans, meaning, sorry, your highest, I think it's $1 million of coverage. So they're going to be a little more expensive. Then you have your copay plans. These plans include doctor copays. They're the most expensive, but you also get $5 million of coverage. And then you have the essentials, which is going to include $250,000 of coverage.
Yeah, well, all the carrier is Aetna. Why cannot we get through Aetna website?
Uh, because it's like an association type deal.
Okay,
Um, they use Aetna's PPO network of doctors, but Aetna's not providing the coverage. Aetna's just providing the doctor network.
got it.
All states providing the coverage and handling the claims.
Okay,
They just let Aetna just lets Allstate use their network of doctors.
okay.
So very simple to quote. And the nice thing with Allstate, the more that you add, like let's say we add one of the accident plans, um, it will lower the premium. See, they get a little bit of a discount. They do a multi-insured discount.
Mm.
Um, so anyways, that's kind of where you go to quote it. So the accident plans are right here. They call it the plan enhancer. There's a few different options, anywhere from 2,500 benefit all the way up to 17,500. And if you add it, they'll let you add cancer, sickness coverage, or all three, sickness, cancer, and hospital coverage as
But
a
the
rock.
extra coverage only like up to less than 20K.
Yeah, right. It's a rider based on the plan you pick. So if I do the 5,000 plan, these riders are only going to give you up to $5,000 of coverage for any of those items. So what I recommend doing is just do none of the riders. So just have the plan itself. And then we go over here on the left-hand side and do cancer, heart, and stroke for 25,000.
Mm.
And there's a bundle package. So if I for that plan that Mary sold, I would probably do a 7,500 accident plan and a 25,000 critical illness plan, 47.53 a month
Okay.
Mm.
Okay.
for a 34-year-old female. Very affordable.
Mm.
Um, they also have term life critical illness. This is the same as that cancer, heart, and stroke, but it includes term life. So if they pass away for one of those conditions, they get that benefit. It's kind of like a hybrid. It's like life insurance and critical illness.
Mm.
Um, this plan is very popular and it pays the most commission, I think, out of all the critical illness plans. So there's different ways we can package it, but you can just hit apply and it takes you right into the application. And then, you can do Mary Jones. Continue.
How much is the commission?
Depends on the product. I can
Mm-hmm.
send the street level guide out to you, Maggie. I know you're probably set up at a higher level, but
Roughly, roughly, give us some
generally,
idea. Mm-hmm.
generally
Several dollars per month.
for the accident plan, I think it's like 55%.
Oh, that's
So
not bad.
you're looking at anywhere, 50, 60% commission on a lot of these plans.
Okay.
The
Oh,
dental
Mary, it's
plan,
much better than we thought.
yeah, the dental plans might be 30, 40%.
Okay.
So it's really good.
I haven't
Yeah,
got my commission. I will let you know, Maggie, if I got my commission.
I'm just curious.
Yeah, so I hope that was helpful.
Yeah, it's very helpful, of course. So this kind of things that we should know so we can cross the selling, just add on,
Ex-
right?
exactly. Just add
Yeah.
on. Can add it to other clients. Make a
Mm,
little extra money.
mm.
So for the healthy American, we need to
There's not a
register.
Yeah,
Also,
so for Healthy America, once you get contracted, you get an email from Caitlin with the agent portal. And I don't
yeah,
have it on this computer. I have it saved on my other computer.
okay.
But it's super easy to quote a Healthy America. Um, I will s-
Oh,
I will
actually, I got one. One second.
I will
Mm,
look at there's certain plans that pay more commissions than others with Healthy America. So what I'll do, because I'm learning Healthy America, I've only sold a few policies with them.
is that this one I put into the chat box?
Yeah, that looks like it.
Okay.
And I don't have a all state thing. I mean, I searched my email, I never found it. How do I know my username?
Um, you may want to call Garrett to help you, or just call Allstate directly.
Garrett.
But
Okay. Mhm.
you may want to register your account I'm not sure exactly how to do that, to be honest with you, Maggie.
Okay,
Rely
that's
on
fine.
Google. Are you a current member of the business association? You put no. Would they
What's
like to?
this? UBA is what?
UBA is part of Healthy America. UBA, it's an association. So Healthy America uses a group chassis. So
Mm.
everyone who enrolls in Healthy America has to be part of this association. It's called the United Business Association to get the coverage. And they're able to offer these policies for lesser rates because it's considered a group plan.
So this is basically the quote website.
The what
No?
website?
Quote. This one, UBA is
Yeah,
the
this is the
quote.
quote website, exactly. And
Okay.
then so you hit yes, you want to enroll in the business association, and then there's different products.
Mm.
They also have dental vision. Let's just select all of them.
Mm-hmm.
Texas. Let's just say an individual.
Mm-hmm.
Um, so these gap plans really not they're not expensive. There's $5,000 in accident and critical illness for, you know, for $25 a month. That's not bad, but it
Mm.
only pays 10% commission. The ones that pay higher commission are going to be the ones that have the plus next to it. The Gap 5,000 plus, the Gap critical illness plus. Um, there's also the Gap Edge plus.
Mhm.
Those are probably the main Healthy America plans, the ones with the pluses next to it.
Mm.
Um, they also have a really good vision plan if someone wants just vision coverage.
Mhm.
$15 a month through VSP Vision. And then maybe someone doesn't want dental coverage, they can't afford it, but they want some dental discount. There's a dental discount plan that will save them money and give them discounts at dentists. There's also virtual health. So like that Blue Cross plan doesn't include free virtual health. So you can sell them teledoc where they can do free virtual health visits.
Okay.
Um, so we could, and then they have a decent dental plan. It's called FCL Dental. It's, 45, you have to add $10 for the association, but it's $45. It's a pretty decent dental plan. It has a waiting period though.
Major service after 12 months.
So
Okay.
we can do a separate training on this. I know Caitlin has a lot of them, but just know when
Mhm.
you're if these gap plans, the ones without the plus are great, but they're going to pay the lowest commission. Now, what I like about Healthy America, it pays level commission. It's the same commission paid out every year, and it's 6 month advanced. So you get
Okay.
paid fast. But if you sell the ones with the plus next to it, those are generally 30, 40% versus Allstate, you might get a higher percentage the first year, but every year after it's minimal.
Okay.
Mm.
Versus Healthy America, it's the same percentage every year.
You are
Mhm.
talking about renewal, right?
Yeah, when it comes to renewals,
Mm.
these commissions are better than Allstate
Okay.
Okay.
when it comes to renewal. Allstate will pay more up front though,
Mm.
because
I
it's a
think
higher
this one
higher
is,
percentage.
sorry for interrupt. I think their premium is cheaper than Allstate too. Looks
They
like.
definitely are, and you get a little bit more coverage.
Yeah.
Like this plan, right? Let's see. I mean, this plan for $75, you get
Mhm.
25,000 accident, 25,000 critical illness, $500 emergency room benefit, $125 benefit that they pay for doctor visits.
Mhm.
You get the telehealth, you get the dental discount program. They send you free vitamins once a month. You
Okay.
get you get an identity theft protection. So you get a lot of extra benefits.
So what is this network? It's
Uh, there is no network. It's just a supplemental plan.
uh so it's just a supplemental plan. They can see the doctor to pay
Well,
cash and then claim here. Is that correct?
yeah, so what happens is when they go pay cash for the dentist doctor, they can
Hmm.
file a claim and get reimbursed $125
Okay, got it.
on that particular plan,
Okay.
right?
Okay.
But
Hmm.
this plan up here is just an accident plan. Uh,
Hmm.
so there's another one. There's a 10,000. I don't see it on here. I don't know where it went. I
It's
selected
here.
all.
It's here.
No, I
Yes.
thought there should have
Mhm.
been a gap
Oh, gap 10,000. Okay.
10,000. I guess there isn't a 10,000 plus. But if you can try to present the plus ones first, it'll be the
Mhm.
most beneficial. But, if you're just trying to be a nice agent, save them some money, these plans right here are good, the ones without the plus, but you don't get paid as much. I think it's only like 10%.
Okay. Hmm.
So perfect. And I don't want to take much more of y'all's time, but was that helpful? We went over
Very
Yeah,
everything.
very
helpful.
useful.
Very
One more
helpful.
question
Yeah,
here.
very helpful. Helpful.
So I saw the first plan is a free, is a prescription plan,
It's a discount drug plan.
but it's
So
free. That means you can enroll it for free.
you can enroll for it for free, right? So you can get a free discount drug plan. It's like Good RX.
Okay.
Oh,
So let's say you sell them a short-term medical plan that doesn't have drug coverage, or that bronze plan doesn't have the best drug coverage. I would give them that discount card. It'll probably save them on their prescriptions.
Okay.
This
That's
is just
good.
a membership. It's free, right? So, but when you take the medicine, buy the medicine, you will still pay.
You'll pay for the medicine, yeah, but it'll be at a discounted rate.
Hmm.
Um, let's see. Yeah, so Healthy America has a lot of great products though.
Okay.
And no, and this sets you apart from other agents because no other agents can sell these products. It's exclusive to Empower.
Hmm.
So that's nice. So you'll know no other clients have this plan. You can even replace if they have Allstate with these plans because they're cheaper.
Hmm.
okay.
So, if you want, are we gonna set up another meeting for next week?
We will.
Okay.
Same
Well,
time,
Yeah.
Tuesday.
same time Tuesday.
Are you
Uh,
okay with that?
yeah, I'm okay with that unless life happens for any reason. But next Tuesday sounds good. Do you want to do it in the evening, morning, afternoon, same time?
Same time.
Same
Same
time.
time.
Okay,
Yeah.
perfect. Well,
We
any other questions you want me to go over really quick?
we can set up this time as a regular. As a regular weekly training or in line. So it's since we do not communicate, with each other, and it's better to have this kind of training and in line, online meeting together.
Yeah.
Next week, I will invite another gentleman. He has a what is it called again? UHC, right? It's called you
Yeah,
no you
we'll talk to them, the U.S. Health Advisors.
the provide yes, US Health Advisor. They use UHC network,
Mhm.
but it's indemnity.
Right.
He has yeah. So we can review that and see what's different. I temporarily reviewed one of the plan. Then said it's not good because the Mary had a client last year. I reviewed that because indemnity basically they only pay certain amount, just like a supplement plan.
Yeah,
That's
exactly.
Mm,
correct.
But it's
Hmm.
way more expensive.
yes, but they
Yeah,
call the private
they
health
call
plan.
it a private plane. Yeah, I know. It's bad. It's just all
Confusing.
around bad.
Yeah. Okay. So in that case, We may, by the way, Mary, you may want to contact the other agent to recruit him to Empower instead of he's selling the
Yeah, he's selling fat
the
Yeah,
product.
sure.
We'll
I
help
will
him
talk to him.
yeah.
sell
And
better
bring
product.
him here through Savas. Yeah, we can invite him to the meeting and recruit him.
That's right.
Uh-huh.
Well, perfect. Well, thank you,
He's a
ladies.
captive. Yeah. All right. I recorded this and